Hi everyone, Kitty Clinical here with part 4 of Biochem. Step 1 thoughts. We're going to talk about purine salvage deficiencies and other deficiencies associated as well. So we talked about ribose 5-phosphate going to IMP via PRPP synthetase. PRPP synthetase again leads to that whole pathway, right, via de novo synthesis that eventually gets you IMP. IMP eventually becomes AMP, nucleic acids. AMP becomes adenosine. IMP becomes inosine. And adenosine can get you inosine, but that's actually can be inhibited via severe combined immunodeficiency, which is an autosomal recessive inheritance. ADA is adenosine deaminase, and that's what gets you from adenosine to inosine, and that can be inhibited by cladribine and pentostatin. All right, so inosine gets you hypoxanthine, and hypoxanthine can become xanthine via the xanthine oxidase. Xanthine can become uric acid via xanthine oxidase, and again, allopurinol and febuxostat are the two medications that inhibit xanthine oxidase. Xanthine to uric acid and uric acid to allantoin via rasburicase or urate oxidase. IMP, going back, becomes GMP, which is, again, the nucleotides becoming nucleosides. Guanosine. Guanosine becomes guanine, which is a free base. Guanine can go back into GMP together with PRPP, but just keep in mind though that this might be inhibited this might be impaired in Lesch-Nyhan syndrome. Lesch-Nyhan syndrome, which is basically impairment of HGPRT, which I will only say this once, hypoxanthine guanine phosphoribosyltransferase transferase. Lesch-Nyhan syndrome, you'll see that in like people who want to, they say like self-destructive behaviors. So associate Lesch-Nyhan with that, and PRPP with hypoxanthine also going back into IMP via the HGPRT, which again is inhibited by Lesch-Nyhan. Since we're on free bases, I want to also talk about adenine, which together with PRPP becomes AMP via APRT. So keep that in mind as well. APRT standing for adenine phosphoribosyltransferase transferase. Adenosine deaminase deficiencies. So ADA is required for degradation of adenosine and deoxyadenosine. A decrease in ADA leads to an increase in DATP. One of the major causes of autosomal recessive SCID or severe combined immunodeficiency. Increased DATP leads to decreased ribonucleotide reductase activity, which leads to decreased DNA precursors in cells, which eventually leads to decreased lymphocytes. So adenosine deaminase deficiency, you should associate that with decreased lymphocytes. Lesch-Nyhan syndrome, we talked about this before. You get self-destructive, self-mutilation, aggression. You can get gout, hyperuricemia. You can get these, orange crystals in the urine, and you can also get dystonia as well. Treatment for Lesch-Nyhan syndrome is allopurinol or febuxostat because again that will help. The defective purine salvage due to the absent HGPRT, which converts the hypoxanthine to IMP and guanine to GMP, compensatory increase in purine synthesis or an increase in PRPP aminotransferase activity leads to excessive uric acid production, and again, this is an X-linked recessive trait. So what does that mean, X-linked recessive? That means that if a female has a carrier of Lesch-Nyhan, well, do they have Lesch-Nyhan? Probably not, right? Because they have the X-linked recessive, and their other X-link is going to be more dominant, and that does not have it, right? So if they're a carrier, then the normal X chromosome is going to be the one that that will be just fine. That's basically the X chromosome saying, hey, female cell, we're totally cool. But the male cell, right, if the male is a carrier of the X-linked recessive, then the male is going to have only one X chromosome. So even though that's an X-linked recessive, that gene is going to be pronounced. It's going to happen, so to speak. So other things you should keep in mind with Lesch-Nyhan is intellectual disability and macrocytosis. There's a lot of different genetic code features that we'll talk about real quickly. The unambiguous is that each codon specifies only one amino acid. There's also a degenerate or redundant, which means that most amino acids are coded by multiple codons. An exception to this would be methionine, which is AUG, and tryptophan, which is UGG, which are encoded by only one codon. But this is important because of the wobble effect, right? Remember the wobble effect being that codons that differ in the third position may code for the same tRNA or amino acid. Specific base pairing usually required only in the first two nucleotide positions of mRNA codon. And then you get commonless or non-overlapping, which means that you read from a fixed starting point as a continuous sequence of bases. Some viruses are the exception to this rule. And universal, which is when genetic code is conserved throughout evolution. So an exception to this in humans is mitochondria. So we went through that pretty quickly. Hope you enjoyed this brief discussion. We will move on to DNA replication.